We do offer free consultations right now because the patient should understand what are the pros and cons and whether we can deliver the service or not.
He still has to make some money and profit still, but if he's suggesting it, we'll follow that because it makes sense, to come in. Most people don't really know a lot about implants. And then you want to be able to give them whatever treatment plan, and then not everybody can afford it, may need alternate treatment plans, but to be able to showcase what we can do and for them or the alternatives that they can use is a big thing. And then they look at, and then we have a treatment coordinator that, and like I said, I don't normally do this with the kids. We don't normally have treatment coordinators, but I think it's essential when you have this because there's so much explaining that you can do, and then there's videos and so forth to educate the patient, and then you need staff that are taught to educate them, go over the finances. As we were saying earlier, you don't really need to get into discussing the finances with people and the fees and so forth. And then sometimes not everything is implant. And then you have the cosmetics and so forth, the denture or the partial or some other crowns that you may need to do, correct?
So in adult dentistry, all cases cannot be treated as implants and all cases cannot be treated as fixed crowns. Sometimes we don't have, the bone might be too much resorbed and we cannot be able to build up the bone. In those instances, we might go with a removal. So the treatment plans that we give, it depends upon the patient and their present situation, clinical situation. We do offer free consultations right now because the patient should understand what are the pros and cons and whether we can deliver the service or not. So that's why we are doing free consults at this point to get the perfect education for the patient so that they could make a good judgment out of it.